Hi everyone, we are Team 11 and we want to introduce our comparative analysis of age-related mortality risk in American and German female breast cancer patients. In general, our study aims to analyze and compare the survival rates of American and German female breast cancer patients, while preliminary observations suggest that American patients generally experience a lower risk of death compared to their German counterparts. Our objective is to delve deeper into this phenomenon. We will particularly focus on understanding how survival risk correlates with survival months across different age groups and nationalities. In our analyzing process, we have three datasets. The first dataset is the SER breast cancer data, which is provided by the National Cancer Institute, which is the authority on cancer incidence and survival data collection. SER collects and publishes data covering roughly 48% of the United States population. And then we have second dataset. It's also from SER database, but it has a large number of additional variables to consider. So especially we use the risk categories and vital status in this dataset. And the third dataset is German breast cancer data collected from 1983 to 1989 by the German Breast Cancer Group and sponsored by the German Federal Ministry of Research and Technology. The data was collected for several studies performed by the GBCG, including role of isolated local regional recurrence of breast cancer, result of 4 prospective studies, and randomized 2x2 trial evaluating hormonal treatment and the duration of chemotherapy in node-positive breast cancer patients. In our analyzing process, we are most interested in looking into what impacts the survival of the patients. And we want to ask questions such as, does race have an impact on the survival rate of patients with breast cancer? And what other factors affect the risk of death of this woman? In our final model, we include estrogen status, tumor size, and age, and we found that the p-value is small enough, which means that our variables for the final model has statistical significance. And for our German groups, we include estrogen status, size, and age, and we found that the p-value is also small enough, which shows that they have statistical significance in our final results. And then here is the survival probability over time for American female breast cancer patients by race. And we also have survival probability over time for American female breast cancer patients and for German female breast cancer patients within different age groups. And here go back our big picture page. We have conclusion that American female breast cancer patients experience a greater risk of death as they increase in age compared to their German female breast cancer counterparts, except for the youngest German group. Furthermore, within the American group, white breast patients experience more exceptionally large tumors than the other racial categories, which may increase their mortality risk. And thank you. Here's our final result.